Hello everyone, this is Dr. Yaşar Başar talking. I am consultant andrologist from Istanbul. Today I would like to talk about selective dorsal neurectomy surgery for primary premature ejaculation. As you all know, we have a big andrological center based in Istanbul, and today I would like to talk about as an expert of premature ejaculation surgery, and I would like to talk about the selective dorsal neurectomy surgery. As you all know, premature ejaculation is the most common male sexual disorder, and there are some interventions to cure premature ejaculation surgically, and these surgeries are generally performed in South Korea and other Asian countries when they are so far, and we are a good option for treatment of premature ejaculation, especially a close center to Europe and USA. I would like to talk about whole details of selective dorsal neurectomy surgery in this video. Selective dorsal neurectomy is the procedure that is done for the treatment of premature ejaculation. Premature ejaculation is the ejaculation, especially in the first 1 or 3 minutes of sexual intercourse. If you have primary premature ejaculation, lifelong premature ejaculation, if you have symptoms for lifelong and your latency time is so low, less than 1 or 2 minutes, generally this is a trouble for male for their social life, for their sexual life, for their marriages, and you're trying to cure your disease with some creams, with some sprays, and for some medications, behavioral treatments. But if you are tired of doing these such things for treatment of premature ejaculation, you have to listen me carefully, because some sprays are not easy to use, because sexual intercourse is something on demand. It's something so fast. You have to be ready always for the sexual intercourse. And in this video, I will describe the mechanism of the selective dorsal neurectomy surgery. In selective dorsal neurectomy surgery, some patients are suitable for the surgery. To be suitable for the surgery, first of all, your symptoms have to be lifelong symptoms. If it's secondary primary premature ejaculation, you are not suitable for the surgical treatment of premature ejaculation. The second thing, we have to show the hypersensitivity in your penis, because when we are cutting the nerves, we are trying to control the hypersensitivity in the penis, and if you don't have any hypersensitivity, the surgical treatment will not be effective for you. To show hypersensitivity, we have some tools. First of all, getting benefit from some creams and local anesthetics are the best marker for the presence of hypersensitivity. But if you didn't use any creams or sprays, or if you are not sure about the effect of the sprays or creams, we have some specific tests, sensiometer test or pelvic perineal neuromuscular evaluation device test, and some electrophysiological studies can show us that if you have hypersensitivity or not. And the third step, you have to be tired of doing other treatments, or you have to be the one who failed with the other treatment modalities, just like psychotherapies or just like medications, or if you have some side effects from the other treatment modalities, you are suitable for the surgery. In surgical treatment, it can be done under local anesthesia or general anesthesia. First of all, we have to choose the anesthesia type, because in my clinical practice, over 90% of my patients are getting the treatment with the local anesthesia. There is no need to get any general anesthesia for those such easy procedure. And in surgical treatment, we try to detect the nerve mapping in the penile dorsal area. In dorsal part of penis, the upper part of penis, there are some nerve bundles on the top of the penis. We are trying to detect 360 mapping of the nerves, and we are trying to understand the neural mapping of the penis. And after understanding the neural mapping of the penis, we are trying to cut some of nerves, and we are trying to preserve the sensation after cutting the nerves, because we know that the patients are afraid of getting erectile dysfunction after the surgery and the loss of sensation, numbness after the surgery. If you cut properly, if you select the nerves to preserve properly after the selective dorsal neurectomy surgery, you will be having a great sensation after the surgery. Just with the surgical treatment, you get rid of the hypersensitivity of the glands of the body of the penis. And for erectile dysfunction issue, if you don't cut all of them and the sensation still goes, you don't get any erectile dysfunction. Patients are asking me about, the doctor, I'm using sprays and creams. After creams, I get some ED, and I'm afraid of getting ED after selective dorsal neurectomy surgery. But this is not true, because the sprays or creams, local anesthetics, generally do ablation of nerves, numbness for non-selectively. They don't select any nerve bundle, and your sensation is gone, and so you don't feel anything and you get ED. But in surgical treatment, we still preserve some nerves of penis, and so you still continue having having sensation for the penis and you don't get any ED. And erectile nerves are completely different from the sensory nerves. We don't even see erectile nerves in the surgical treatment because erectile nerves, the cavernous nerve, goes into the penis from the root of the penis, when these nerves are sensory nerves and located on top of penis in the dorsal part of penis. We don't give any harm to cavernous nerve, which is the erectile nerve in the penis, and these are just the sensory nerves, and there is no risk to get erectile dysfunction. If you do selectively a good surgical technique, you don't get any erectile dysfunction and loss of sensation after the surgery. The third topic that patients are afraid from the scientific studies are the pain. There may be some neurinoma pain after the surgery if you don't use some proper cauterization, but if you do use proper cauterization, you don't see any pain after the surgical treatment. We are one of the highest centers located in Europe to perform selective dorsal neurectomy surgery, and we have some special techniques just like minimal invasive neurectomy or other techniques to cure your premature ejaculation. First, if you consider getting premature ejaculation treatment, you can start with a non-surgical cryoablation treatment, or you can go directly with the surgical treatment of premature ejaculation. You can see our first paper which published in AUA Congress last year, and there will be some other scientific papers to show our results after surgical treatment, and you can join our pool to have which are cured from premature ejaculation. This is a common disorder and this is a severe condition for male to deal with. If you have some problems with the premature ejaculation, if you want to cure your disease, if you want to have a great sexual life, you can contact my team and learn much more about treatment of premature ejaculation.